So it's it's on, everyone. Thank you so much for the a very special webinar for the World Hepatitis Day this year. As you may know that we always saying that we have to celebrate the World Hepatitis Day. But could be the one of the, I would say, the only year that I'm not going to use to celebrate, because the things we're going to talk about can totally reflect my mood, my vibe during this year. Why I'm not going to celebrate? Because it's not looking good globally for the viral hepatitis um, improvement and the roadmap, and, there's nothing can compare with what we think it's going to be. Um, but nonetheless, here we are. We have to join this event. We have to use the World Hepatitis Day to mobilize everyone in the world to tackle this horrible disease. It's not going anywhere by if we can just take a look at the Global Hepatitis Report this year. It reflects me many months ago. Let's not say many. It's only like 1.5 months ago. When we saw the figure presented by our dearest WHO colleagues, nothing is looking good on the map. Nothing is going to look good on the graph. So we protested, and we also wanted to raise the voice for all of us to say this is not okay. We have to do much more to make it happen, to eliminate the viral hepatitis. Um, my name is Dee, the president of World Hepatitis Alliance. You may see me from now and then in many meetings, many webinars. So today I'm the chair for the very special event for the World Hepatitis Day. So today's event is the first of the World Hepatitis Day webinar series. So during this webinar, the speakers will examine and reflect on the new data from the World Health Organization Global Hepatitis Report 2026 and explore how stakeholders can work together to achieve the elimination goal, and more importantly, to prevent the liver cancer cases. The report shows that the hepatitis is the world's deadliest communicable disease, with the number of the deaths continuing to rise. So since the last WHO Global Hepatitis Report in 2024, well, back then we can still say, well, we can still wait. We have new drugs. We have the commitment is not there, but we need to move forward with lots of different things. But 2 years later, we're still going nowhere. Some of the data is even getting worse. So the progress towards achieving the elimination goal has been made, especially the WePro region, where I am now, has doubled the number of people living with the hepatitis B and C who have been diagnosed. So, however, many people living with hepatitis continue to remain undiagnosed and without access to treatment. In the zero region, my favorite region, the percentage of diagnosed people living with hepatitis B only increased by 0.2%. Urgent action is needed now to ensure that no one dies from a preventable disease. Just want to let you know that we are going to use the very precious opportunity to at least one for the alliance to know how you feel about the number. The second, in what way are you going to talk to the WHO colleagues? How do you feel like the number on the ground? And more importantly, to discuss and explore different methodologies to tackle these challenges. So some interpretation notification. The meeting is offer simultaneous interpretation. All you have to do is move your mouse or maybe your finger to the bottom to say translate and to go to the language that you prefer to listen to. But the numbers are the numbers. It's more than anything that you could really using the word to analyze, to predict what's going to be the future for the viral hepatitis elimination goal. But the more importantly, we have our very good friend of ours for the Alliance for the Community, who is working around the clock to try to work together with you. Here is Dr. Teresa from the World Health Organization. She's the Director, Department for HIV, Tuberculosis, Hepatitis, and STIs. She's going to deliver her very, very heartily video recording for our webinar. Without further ado, please.
Dear colleagues, partners, advocates, and friends, it's a pleasure to address you today on behalf of the World Health Organization ahead of World Hepatitis Day 2026. I thank the World Hepatitis Alliance for convening this important event and for bringing together civil society, community, clinicians, policymakers, and partners united by a shared commitment to ending viral hepatitis. The 2026 World Hepatitis Report offered both encouragement and a clear call for action. Progress is being made, but it remains too slow. Hepatitis B and C still cause about 1.3 million deaths each year, mainly from cirrhosis and liver cancer. Yet many of these deaths are preventable. We have vaccines, diagnostics, effective treatment for hepatitis B, and curative treatment for hepatitis C. The question is no longer whether elimination is possible, but whether we can deliver these tools equitably and at scale. This is why today's discussion is so important. The new data helps us identify the remaining gaps and point to where action is needed. To reach the 2030 elimination goals, we must expand testing, simplify service delivery, integrate hepatitis services into primary health care and related programs, strengthen prevention, and make liver cancer prevention a central part of the hepatitis response. Partnership with civil society and affected communities will be essential to success. As we prepare for World Hepatitis Day 2026, our message must be urgent but hopeful. Elimination remains within reach if we accelerate together. Let us use this webinar to align and amplify our voices and strengthen the partnerships needed to prevent avoidable death and achieve the 2030 goals. WHO remains committed to working with the World Hepatitis Alliance, civil society, governments, and all partners to turn global targets into measurable impact for people. I wish you a successful deliberation. Thank you.
Wow, it's what I'm going to say is, as usual, is as always that the Dr. Teresa would use her tongue to do whatever she can to bring people together. As we know that the WHO is facing a lot of different challenges, but at the end of the day, that I'm just so glad I can fight alongside with these warriors, with more and more limited resources in the coming days, even in the coming months. One of them, a very, very key partner, good friend of mine, Professor Fumi, and she is going to use in the next 10 minutes to really to talk about, to share the overview of the key findings from the WHO Global Hepatitis Report, including diagnosis, treatment, and vaccination rates. I think this is my first time to see the wording, the title of her, for sharing is using growing global burden of the hepatitis. it really means a lot. Just take a look at my background, that hepatitis C is under control. No, it is not. It's not even far from being controlled, even though we have everything ready. So maybe we'll want to know how bad it is, and maybe in what way we can turn around the situation. So please, for me, I'm gonna ask you to to use 10 minutes to talk about the overall of our global hepatitis report. Thank you.
Thank you very much, Dee. Can you hear me? Great. So I would start by thanking World Hepatitis Alliance for organizing this very webinar to break down the Global Hepatitis Report. And I'm excited to represent WHO to present this report. Like Dr. Teresa has said, it's a report of major consequence, and it shows where progress is being made in the viral hepatitis response, where it's stalling, and where the gaps remain. It's actually a report of major consequence, and it provides the most comprehensive country-informed assessment to date of the hepatitis B and C response. Now, the data draws on country reports from 140 countries and other UN system data, including vaccination data, program reports, systematic reviews, modeled estimates. Our department worked on this product for over 1 year, and it required partnerships, including with World Hepatitis Alliance, and over 100 people participated in the development of this report, and it was proudly presented at the World Hepatitis Summit in Thailand in April. But before I jump into the report, I want to remind us of how we got this far, how the global response is framed by the World Health Assembly resolutions of 2010, 2014, 2015 SDG, flagging to combat hepatitis. And in response to all this global call, WHO developed the Global Health Sector Strategy in 2016, which was renewed in 2022. And the strategy for the first time called for prevention of new hepatitis B and C infections by 90% decline and reduction of death rate from liver cancer and liver cirrhosis by 65% relative to the 2015 baseline. Now, this strategy provided a roadmap, defined impact targets, and priority interventions. The vehicle to deliver elimination was a public health approach. And this brings me to where we are now. This is an infographic that was developed from the progress report, showing, in a nutshell, some of the major findings from the report. A global burden of 287 million. Below that, an incidence of 1.8 million new cases in 2024, which is the data that we have. The mortality of 1.3 million deaths per year. And what Dee had alluded to since 2015 at the bottom of the page, liver cancer rates are rising, and that was not the plan.
Just wanted to flag your slides are not changing on the screen.
Are they changing now?
No, they're not. Would it be helpful for me to share my screen?
Okay, sure. Okay, maybe
give me 2 seconds.
Or I could share again.
Yeah, if you try sharing again for me, I believe it was in presentation mode, and we were seeing the preview window.
Okay. Can you see the presentation mode now?
Yes, we can see it. We can also see the next slide. I'm not sure if you can make it full screen.
Okay, it is full screen from my end, so maybe you'd share it from your end. Okay, would you want to share it?
I'm happy to. If you could just take down your slides, I will bring them up.
Okay. Okay. Okay, so I just wanted to quickly show what the infographic showed, as you have seen. Next slide. And some of the major highlights. And like Dee has said, but I must say, look, there are some progress, there are some major progress, but there are also lots of gaps. There are 240 million people living with chronic hepatitis B infection. I think what is remarkable is that the prevalence declined by 7.4% across all regions since 2015. And one of the beautiful things about seeing a global slide like this is that sometimes the figures can conceal regional differences. And you would see from this slide in blue areas of the world that have a very high prevalence of hepatitis B. So we're looking at the African region and the Western Pacific region. But there's also hepatitis B in all regions. We're looking at migrants, people who inject drugs, prisoners in different parts of the world. But the concentration of the burden is in two areas. Next slide. The next slide shows the hepatitis C epidemic with 47 million people living around the world. And you would see on this slide that hepatitis C infection is more dispersed across all the regions compared to the hepatitis B burden. Despite these three countries with a large population comprise nearly 40% of the global burden. Next slide. The next slide is an iconic slide, actually. It's iconic because it provides a picture of the latest status of the progress, and it acknowledges gaps and acknowledges progress, but raises the alarm on the huge gaps in prevention, testing, and treatment. And what we see on this slides on the left is the impact target, and the first line is about the indicators. The green line is the progress along the path to elimination. And you'll see that the red targets, the red circles, are the elimination targets for 2030. What is remarkable on this slide is the red arrow that is associated with hepatitis B deaths, showing a reversal. So instead of progressing towards 2030, there's increasing burden of liver deaths. On the right, we see the service coverage gaps. Again, the green in progress, the red targets, and the blue shows very clearly the gaps in reaching these targets. Next slide. And I'm going to spend the next few minutes highlighting 4 of the major findings from the global report. First, we have the new infections, which has declined globally by 33%. And flagging, of course, we have the hepatitis B vaccines. And of course, we know that newborn and young children have the highest risk of chronic infections. Next slide, please. The next slide shows us the regional breakdown, and it shows that clearly the hepatitis B prevalence among children under 5 has declined globally. That is the global target. However, there are differences within regions. Some regions have very low prevalence, and over 85 countries have a prevalence below the 2030 target of 0.1%. Next slide. The next slide talks about the new hepatitis. It talks about the vaccination. Now, WHO has recommended newborn vaccination for birth dose within 24 hours and childhood vaccination. Now, the global coverage of timely birth dose is low globally, but it has significant regional variation, which I've tried to show on the left figure, showing that in some regions, birth dose is as high as 70%, but the lowest coverage of birth dose is in the African region, where it's 17%. So we're looking at the highest prevalence area having the lowest birth dose. And many reasons have been alluded for this, including structural challenges in many LMIC countries. Next slide. The next slide shows the childhood vaccination, which in 2024 reached 84%. 84% is on the track to elimination. You would see that 4 regions have already reached the 90% target for routine childhood vaccination. That's the hepatitis B1, B2, and B3. This shows B3. However, again, in Africa, 76% B3 coverage, as well as in the Eastern Mediterranean region. Next slide, please. We now look again at the new hepatitis C infections. It declined globally by 8%. Of course, it's far off the 80% target. But looking at the regional profiling and trend also flags some inequities. In all regions, the new infections are declining, but in the Eastern Mediterranean region and the European region with the largest decline. In red highlights is the regions of the America that shows an increasing trend of new HCV infection. And part of this is related to the opioid epidemic, and the urgent need for region-specific strategies are flagged. Next slide, please. I think the most distressing finding is the rising mortality rate from liver cancer and liver cirrhosis. And you would see the 17% increase in death rates for hepatitis B. And this is what Dee has alluded to, that instead of decreasing mortality, mortality is increasing for B. For C, more expectedly, the mortality is declining and has declined by 12% from the baseline. We expected 65%. So it's slower than is expected, but it's in the right direction for hepatitis C. Next slide, please. And the next slide is to describe and compare deaths among major infectious diseases. You can see that hepatitis B is that disease whose mortality is rising over time compared to HIV that is declining, hepatitis C, even TB deaths are declining. But the hepatitis B deaths, which is usually due to lack of access, lack of treatment, despite the availability of the tools. Next slide, please. And as I'm rounding up. Next slide. Let's look at the coverage of hepatitis testing and treatment. Like we said, testing and treatment will drive mortality down, not just prevention. We have all the tools we need for testing. We have the treatment. We have the rapid test kits. We have suppressive therapy for hepatitis B. We have curative therapy for hepatitis C. So let's see how they perform. Next slide, please. And if we look at how they perform, what we have here is globally, nearly a quarter of people living with chronic hepatitis B have been diagnosed. Compare this with HIV, 95%. So this is just a fraction of people diagnosed, and a dismal less than 5% are receiving antiviral treatment. And look at it on the right, and look at the regional differences on the right. The highest diagnostic coverage is in the WHO Pacific region, Western Pacific, and this is largely driven by progress in China. Next slide. Hepatitis C is a shade better. Diagnosis and treatment gaps persist as well, and only 20% of the people living with hepatitis C have been treated, and it remains low across all regions except in the Eastern Mediterranean region, where this is driven by the national effort of Egypt, which is now a champion country. As of 2024, 11 million people have been diagnosed but remain untreated, a backlog that must be urgently addressed. Next slide, please. This slide shows the 5 priority interventions that is required to reach action towards elimination. We're looking at scaling up treatment for people with hepatitis B, not only in the WHO African and Western Pacific regions, but globally. But the need there is dire, and the death rates are highest in these 2 regions. Scaling up treatment for hepatitis C globally, especially in high prevalence regions and in underserved and high-risk population. Of course, number 3, hepatitis B birth dose vaccination must be increased. The tap must be closed. And number 5, we're looking at improving the coverage of perinatal antiviral prophylaxis for PMTCT for mothers. And the new WHO hepatitis B guidelines really support this rollout and simplification of these services. And number 5, improving safety of injections in the community and including harm reduction for those who inject drugs. And my last slide shows us some of the final reflections. So the report shows us where there's progress and where there are gaps. And more than that, it identifies priority actions as needed. What is clear is despite the availability of policies and tools, despite treatment, despite curative drugs, progress has been too slow and mortality is rising. So we know elimination is feasible. Countries are demonstrating it. We have the path to elimination, and many countries are on that pipeline for global recognition of path to elimination. And finally, with sustained political commitment and investments and access to proven intervention, including partnerships, elimination is real and it remains within reach. Next slide, please. And I just want to acknowledge all the people who have worked. Well, the World Hepatitis Day is coming up, and the acknowledgement of a diverse group of people who have supported the development of these guidelines. So thank you very much for your time, and I do apologize for the logistic challenges in the presentation. Thank you, and over to you.
No, please don't. Your presentation is exactly why we have more than 100 people showing up in the webinar, to really have your interpretation for the the data, and also try to understand what are the key parts for us to focus on. So no worry about the time. We can still catch up. We got to know that nowadays we keep saying that we can't wait. There are things we need to do. So today we invited multiple brilliant speakers from different fields to help us to understand how are we getting out of this horrible mud. I'm not going to introduce any one of you, but I'm so sure it would be much better for you to introduce yourself. So I am going to tell the name first, and then you can introduce yourself about who you are, what is your job, the very simple introduction of yourself. First of all, Dr. Zainab.
Hi, everyone. Can you hear me?
Yes,
Yeah.
very well.
Yes. Good afternoon from Abuja, Nigeria, everyone. My name is Zainab Shinkafi Bagudu. I'm a pediatrician, cancer advocate. I work in lots of public health spaces. I'm also the UICC president-elect with a keen interest in hepatitis because of the obvious relationship that it has with cancer. It's a pleasure to be here ahead of World Hepatitis Day. Thank you.
Fantastic. And Diana?
Hello, everyone. Can you hear me?
Yeah.
Good day, everyone. From the Philippines. First of all, I would like to thank the World Hepatitis Alliance and the organizers for the kind invitation to be part of this important discussion. It is truly an honor to join such a distinguished panel of experts and advocates. My name is Diana Ruiz de Silva. I am the National Officer and Patient Advocate of Yellow Warrior Society Philippines. I have been volunteer since 2017 and have served as a National Officer and Patient Advocate since 2019. I am also a person living with hepatitis B, and my lived experience has inspired my advocacy to improve access to care, reduce stigma and discrimination, and amplify the voices of people living with viral hepatitis. The Yellow Warrior Society Philippines is a patient-led advocacy organization dedicated in empowering people living with viral hepatitis, promoting awareness and prevention, reducing stigma and discrimination, okay, and support the partners with the hepatitis elimination in the Philippines. Thank you once again for having me. I look forward to our discussion today.
And then I would turn to Aniedi.
Good day. So my name is Aniedi Akpan, and I'm joining from Abuja, Nigeria. I work with the community of people who use drugs as a program manager, and we've been providing testing and treatment for people who inject drugs at a community level through the United Funded project. Thank you.
Thank you. And Dr. Funmi will join the roundtable later, all together. But first of all, I'm going to take this very precious opportunity to ask two questions to each our distinguished speakers, because the field that you're working in. Just try to understand that there are so many areas that we as community member cannot reach, and there's so many layers of work that we could not do it, in our lifetime. So I would just want to ask some specific question to you, and how to building this linkage to the Global Hepatitis Report, and also the World Hepatitis Day as well. First to Dr. Zeynep. The data on mortality in the report is startling. Reflecting on that, why do you think it is important to strengthen the awareness around the linkage between the hepatitis and liver cancer? This question is definitely for you. Thank you.
Thank you. Well, there are many obvious reasons and some not so obvious, but I think the deadliness and the reality that we've seen and we've heard about the data, viral hepatitis is now the deadliest communicable disease that surpasses other major infections, infectious killers. So this is a wake-up call, and the 2024 data that shows us that over 1.3 million deaths actually from liver cirrhosis and liver cancer combined. This is a tragic and deadly reminder. Then there's a big awareness gap in that people do not realize many people don't associate the viral hepatitis with cancer. You think about viral hepatitis as an infectious disease, and then of course cancer has its own deadly connotation. But so there's a gap in there. A person that tests positive for hepatitis B or C, they don't worry. They worry more about the acute illness and, yellow eyes and so on, without realizing the long-term effects. So that awareness gap is something that a reason why we need to create more or focus more on the link, and we make people realize that they are carrying a major driver of primary liver cancer. And then it's preventable. What is the point if we cannot, we have all this data, and then we also know that it's preventable. So if we don't link it and really act on it, we will keep on having an increase in the numbers. So we must shout from the rooftops that liver cancer is one of the most preventable forms of cancer in the world. Yesterday, the World Cancer Report was launched, and the liver cancer, we can clearly see it increasing, particularly by the WHO, I must add, sorry to give you the credit. And, it's increasing globally. And this is why we have to do something about it now. Testing and make people realize that testing for hepatitis is a form of cancer screening. Treating hepatitis is preventing cancer.
Wonderful, and very brief but very into the bone answer. It really helps me to really to put an awareness on top of our head to say, it's when you can prevent the viral hepatitis B, you can prevent a lot more on the road. Thank you, Dr. Zeynep. You have the second question later on. So Diana, I want to ask your reflection of the data of the Global Hepatitis Report. and the key challenges facing the WePro region. What action needs to be taken and now to scale up the effort to reach the elimination target? As Fumi just mentioned, WePro is the best student in the region, but most of the numbers were achieved by China. So as for the local NGO in Philippines, how do you feel like this number is going to help you or maybe to frustrate you?
Thank you for the question. First, I would like to commend the WHO for the Global Hepatitis Report 2026, which provides an important picture of where we are today and reminds us that despite the availability of effective prevention, the testing and treatment, hepatitis remains the world's deadliest communicable disease. The report makes it clear that while progress has been made, it is still too slow and uneven to achieve in the 2030 elimination targets. From my perspective, as a patient advocate in the Philippines and as a representative of Yellow Warrior Society Philippines, these findings strongly reflect what we continue to see in our communities. Behind every statistic is a person, a family, and a community affected by hepatitis. Through our advocacy work, we have met individuals who only discovered they were living with chronic hepatitis after developing serious liver disease, leading to liver cancer. Others only learned their hepatitis status during routine medical screening for employment, college admission, which are both discriminatory practices, or antenatal care during pregnancy. For many, that was their first encounter with hepatitis, and unfortunately, not everyone receives the education, counseling, or support needed to understand the disease and seek appropriate care. One of the biggest challenges we continue to face is limited public awareness. Many people still confuse hepatitis B and C with hepatitis A and have misconceptions about how these infections are transmitted. Stigma and discrimination also remain significant barriers. Some people fear being judged, losing employment opportunities, or being treated differently if they disclose their hepatitis status. In addition, access to testing and treatment is still unequal, particularly in geographically isolated and underserved communities. To accelerate progress toward the 2030 elimination goals, I believe we must move to beyond awareness campaign alone and ensure that education leads to action. We need to expand access to affordable and people-centered testing and treatment, strengthen the hepatitis education in schools and workplaces and communities, and ensure that people diagnosed with hepatitis are linked to continuous care. Governments cannot achieve elimination alone. Civil society organizations, healthcare professionals, patient advocates, and affected communities all have essential role in reaching people who might otherwise be left behind. I have one more thing, but we must understand that to be able to do this, the government must decide to invest in its own people, ensuring that they will be screened, diagnosed, and treated with limited or no out-of-pocket payment. We want to see less liver cancer patients because we are treating more living with viral hepatitis. We want to see people living normal lives and contributing to society despite the fact that we have hepatitis. It is fortunate for people like me who can manage to spend out of pocket to get checked twice a year. It is because I managed to get work and I have no other complications. But what about those people who barely managed to get food on the table? Those who could not have work because they were discriminated against, and turned down by employers and those who have other complications as well. At the end of the day, we will prioritize placing food on the table rather than getting treated. So I remain hopeful by working together, investing in prevention and early diagnosis, reducing stigma, and making treatment accessible to everyone. We can transform the findings of this report into meaningful action and move closer to achieving hepatitis elimination by 2030. Thank you.
Well, I'm very glad that you're so hopeful. I have different opinion about what will happen in the very very near future. But with your passion, especially your hard work, it really help us to, being the mover and shaker on the road. So next question to Aniedi. Now we need to talk about the Afro region from time to time. This is the land of hope, but also the land of being ignored all the time. So can you reflect the data, how you feel about the data of the Global Hepatitis Report when you read, we just read the from the report, and also what do you think the key challenges for your region for the viral hepatitis elimination goal?
All right, thank you very much. And looking at the data, it's not exciting to talk about. But also it's a reflection of what is really happening on ground, especially if we look at a country like Nigeria. I think we're just gaining traction on triple elimination. We know that there's very low awareness about hepatitis C, hepatitis B and C. We know that most of our health facilities are not properly should I say, resource to be able to handle cases of hepatitis and B and C. What we've been having really is civil society organizations trying to incorporate rapid testings into their services without any option of getting treatment. And before the United HCV projects, there was really no talk about providing services for key population, the key hepatitis C and B and C key population, like people who inject drugs. So I think, it doesn't look too good. Like a colleague that just finished speaking spoke about in Africa, it doesn't look good. But like Dr. Zainab has talked about, the awareness gap, I think this is first of all what needs to be talked about. And it also applies to me in a way, because prior to understanding what hepatitis is, there's always this tendency that whenever we see symptoms from hepatitis, that it is attributed to witchcraft or spiritual problems or things that people cannot really make out of. And what they try to do is to seek treatment traditionally. If you go around the streets of Nigeria, you still see people posting things like, oh, hepatitis B and C is curable and we can do it through traditional ways. If you check out the treatment procedure, you will understand that it's really not going to solve that. So there's really a low level of awareness of hepatitis in Africa. We also have weak health systems and infrastructures. We have a weak system for vaccination. We have a weak system for screening, treatment, and management of hepatitis B, and even treatment of hepatitis C, which is more or less the low-hanging fruit, including human resources. I know that in Gombe State, where we're implementing the Innovate Involve Inspire project, a United funded project, that we have had to form a collaboration with the state specialist hospital so that we could build the capacity of the healthcare workers in the state specialist hospital to be able to treat, screen and treat for hepatitis C. In the States, when we started the project, we did not have a dedicated GeneXpert machine for hepatitis C screening. So that shows the level of infrastructure deficit for this. And also for funding, also for this, funding is insufficient and unsustainable. Like I said, the program we are running now is donor funded, and we are now trying to see how to work around sustaining the program by advocating with governments and relevant stakeholders to see how government can provide funding for it. The Federal Ministry of Health, Lesi 365, which was supposed to kind of involve extensive rapid testing of persons in all the constituencies or the federal constituencies in Nigeria, and it was to be funded by the legislators, but we didn't really get much out of it. Also because the awareness is low, and also we have the research and technology gaps in Africa, which is around being able to produce the diagnostics, the Genespa cartridges itself, and the drugs to be able to treat maybe hepatitis B and C. I think that is one of the things, and to really for
Aniedi, you can share a lot more about the harm reduction later, because it's exactly the question I want to ask later. Yeah.
Okay.
Thank you so much for the question of this part, and I just wanted to ding the bell to the participants. Raise your hands to ask the question you really wanted to look for from our speakers. And these are very precious opportunity to understand the holistic feelings, reflection, or maybe the solution all over. And the please just bear in mind, you can raise your hand or maybe drop your question in the Q&A session. I have a question for Professor Funmi. We have to address the elephant in the room. What do you think would make a major difference in the hepatitis response, particularly in the circumstances where there isn't a lot of funding?
Thank you very much. And that's a huge question. But before I respond to your question, the colleagues on the call have talked about an awareness gap. And just to note that that awareness gap is huge. If I ask the audience, that is HIV related to AIDS, I think they will all say yes. All of them. I'm sure it will be 99%. If I ask, that is smoking related to lung cancer, I'm sure that 85%, I'm making this up, would say yes. And if I ask that, does hepatitis B and C cause liver cancer? I don't know, Dr. Zainab, like how many people will think that is the truth? Very few, because they cannot understand the lag between birth dose and liver cancer that takes 30 years. And our data systems do not follow that child who didn't get vaccination to that young 34-year-old adult with liver cancer. That's one. Number two, when you feel perfectly well, you don't see the need to do any testing. So the awareness gap is so huge, and we need all of us to work together to do this. So in terms of the specific question you've asked me, we agree that we have all the tools we need. We have the rapid diagnostic tests, we have treatment, we have cure. So we don't really need any major innovation. We even have policies, national policies. The data from the report shows that a lot of countries have policies, but they're not implementing. So in terms of implementation, what do we need to do in low resource countries? For me, I think one of the single biggest game changers in low and middle-income countries will be to leverage synergies and promote integration. It will be to use what you already have on ground. It will not be specialist care. It will not be tertiary center care. It will be a public health approach, redesigning hepatitis services so that it becomes a part of routine health care rather than a stand-alone program. And I would give you examples. If you embed hepatitis into HIV services and maternal health care child case, we can we can deliver triple elimination. Elimination of HIV, hepatitis B, and syphilis on the same HIV platform with a small incremental cost. And that is the prototype of integration. Embedding viral hepatitis testing and treatment with other infections, like we do TB, like we do HIV, like even we do non-communicable diseases. So integrating all of this, and integrating allows us to leverage existing laboratory chains, existing supply chain, existing healthcare worker. The same healthcare worker can do several things. Leveraging the same data system and the same financing will get us halfway to the elimination response. So integration is also sustainable, and it would not incur the dependencies on external funding that we have right now. So it's integration every way you look at it. But integration is not for everything anywhere. It's not a blanket. It's not a blanket statement. One has to look at where we are, look at the region, look at the health system, and find the appropriate synergies that will allow us to take hepatitis care further. And maybe one last thing before I stop. Simplification and decentralization are key in low-income areas. Many programs remain specialist, and that is a challenge. We don't even have enough specialists in many low-income countries. So delivery through primary health care is feasible, and some countries are already piloting and doing this on a national scale, and they are reaching a lot of people that are not being reached in the secondary and tertiary cares. So I'll stop there for now. I'm looking at integration, simplification, decentralization, and I would not yet talk about civil society. I'm going to reserve that for the last, because they have a huge role to play. Thank you, Anoba.
Thank you, Fumi. It's, this could be the best, low-hanging metaphor example to compare with HIV/AIDS, viral hepatitis, and liver cancer. I never thought about it, but thank you so much I'm going to use this metaphor from time to time. And of course, your the name underneath say quoted, from the Dr. Fumi. Again, please raise your question. Also, we have one Q&A from Prince. Yeah, we can deal with that later. We can deal with that later. But first of all, I want to ask the question back to Dr. Zainab as well. Mm-hmm. How can we center hepatitis within the liver? Sorry, how can we center hepatitis within the cancer prevention discussions?
Well, thank you. I think Dr. Fumi has mentioned in principle all the things that we need to do. So I'll just be a bit more cancer specific in terms of the structures that we've spoken about so far. Breaking down the silos is definitely very important. We think about infectious disease, or historically, what we do is that we place infectious disease in one box and non-communicable diseases in another box, like cancer. The funding, the treatments, we're discussing them in different silos. We have to try to merge the agendas. We have the World Hepatitis Report now. How can we highlight the cancer-specific data in it? And that is what organizations at UICC, what we've been advocating for, that is also included in the declaration as well as the our work plan, is how to integrate hepatitis services directly into national cancer control plans. We recently had a workshop where there was a session on this, and we were able to look at the data. Some countries that have done that have shown the effective reduction. Egypt is always a very good example to give of this. Again, secondly, leveraging the existing cancer-specific infrastructure. We don't have to build new systems to, from scratch to be able to center cancer in hepatitis discussions. We can integrate vaccination, screening for B and C into our existing health touch points where we have, the HPV screening, for instance, maternal health screenings. We can also integrate those hepatitis screening. Of course, then there's the funding issue, but that's another matter to be discussed. Again, the funding can be looked at collectively. And at the end of the day, I don't have any study off the top of my head, but I'm sure that just simple economics, if we lump them all together, it will end up being cheaper for us as for different countries and people that are suffering from it. So instead of having a woman going from point A to B to do this and different advocates, different sets of workforce, we can task share and try to ensure that we have more hepatitis into our adult screenings. And then reframing the funding narrative, really, that is one of the most important points that we need to work on to center cancer in the prevention. And again, the World Hepatitis Report mentions this. We have to show our ministers of finance and leaders and the donors all about the economic arguments, how treating hepatitis early is it's really a fraction of the cost of the price of managing late-stage liver cancer or liver failure and palliative oncology care. So these are all things that if we focus more on, then we will have a headway in preventing, in centering hepatitis and preventing cancers.
Thank you, Dr. Zeynep. I'll have to run it real quick to the next speaker. Diana, please use 1 minute of your time to talk about how, Yellow Warrior can contribute as a civil society organization in scaling up to access of the treatment. Real quick.
Thank you. I fully agree that scaling up treatment for people living with hepatitis B should remain a priority, particularly in the WHO Western Pacific region. While the Global Hepatitis Report shows progress in diagnosis, there's still significant gap between diagnosis and treatment. Many people know that they are living with hepatitis B, yet they are not receiving the care they need. This is where local advocacy efforts and civil society organizations play a critical role. From our experience at the Yellow Warrior Society Philippines, we have learned that improving access to treatments begin the empowering patients through education. We have communities better understand the hepatitis B, correct misconception, reduce stigma, yeah, and then we have the communities better understand the hepatitis B, and then encourage people to seek overwhelming and patient organization provides the trusted peer support, accurate information and guidance to help them navigate the healthcare system. Beyond patient education, we also advocate for more affordable and equitable access to treatment. Yellow Warrior continues to advocate.
You have to run it real quick. Sorry about that. Yeah.
Yellow Warrior,
Thank you so much. As we know,
thank you.
your team been doing fantastic job to engage with the local government. And Aniedi, tell me in 1 minute how your organization is helping with the people who inject drugs in terms of Hep C cure and also how to help with the eliminating the viral hepatitis.
All right, thank you very much. So I understand I have 1 minute. The testing and treatment program we are implementing in the States among people who inject drugs is called the community-based simplified algorithm. So what we did basically is to shorten the time from testing, screening, and initiation on treatment, but also reduce the need to move from one facility to the other or to get service points in the health centers. And of course, like I said, there's really not that much infrastructure and personnel available to provide a HCV treatment. So that is how we are going about it. So the testing, the screening, and the treatment is done and initiated at the community-based community drop-in center. And also we use peers, people who use drugs, also to track and also support retention in those services. So apart from that, we're also into advocacy and policy influencing. Right now, I'm at the National Drug Use Summit, where we are arguing the case for services for people who inject drugs and many other things we're doing. Thank you.
Thank you so much. Aniedi, you can check on his website to understand, and also Twitter as well, to see what's the really on the ground work for his organization. Last question for me. You mentioned the NGO, the civil society organization. Tell me how we can play in such a difficult game to win.
So many things. And when we talk about partnerships, of course, we know that government leads. We're looking for multi-stakeholder collaboration. We know that global institutions like WHO support normative guidance and coordination. Donors are key. They are catalysts to change, but civil society and affected community should be engaged in every part of the process, from policy development, from service delivery, and the example in Abuja shows what community can do. The industry and private sector are so important as well. They are part of the partnership. If there's one last word I want to say, it's about advocacy. And Dee, I'm throwing you a challenge, and World Hepatitis Alliance. We've talked about a stigma index, and we all know how we're measuring stigma. I propose that you also do what we call an advocacy index, so that this year we can measure how much advocacy and education we have provided to people. In the WHO report, we reported progress on hard facts. How do we report progress on advocacy and education in the past 10 years? Are we like mortality negative, or are we progressing along an advocacy index? So I'm throwing the challenge to civil societies in the advocacy and getting people on board to understand. At the end of the day, we're looking at political commitment. We cannot sit on the streets and close down the road, and we cannot go to government. But civil society working together have a lot of power. And again, I'm back to HIV. We know what civil society did in HIV. We are looking for that type of civil society for viral hepatitis to lead the way in advocacy. And we are all here to support. We all have our role to play. I know we are short of time. I'll stop right there, but I throw you a challenge. Think of how we can measure advocacy and how we can measure how many people are involved with viral hepatitis. Think how we can convince advocates to come out and speak. In HIV, it has become a huge thing to admit you have HIV. But for hepatitis B, many people are still hiding. Hepatitis C, we're hiding. So we need to do something different, coordinate, collaborate, and really shine and influence the world. Thank you, and over to you.
Professor, for me, challenges accepted. This is exactly the thing that me and the community and also the team will work together on that. Stigma and discrimination index is the first of our things that we want to release to the market. Let's come to the community sector, but challenge accepted is going to be soon that we're going to work on that. I just wanted to, there were a couple of questions. You guys asked the question at the end of the session that leave me with no choice to answer in a very short way. So, but that asks, what can Hepatitis Day campaign can lead to a sustained action throughout the year instead of being limited to a single day event? We have so many other events besides the the World Hepatitis. We have testing week. There are many other countries celebrating things related to the the viral hepatitis, and also the Cancer Awareness Month as well, Liver Cancer Month as well. So just join and search. There are so many things we can do. It really depends on how and what way you're going to work on that. And also, you also asked the what countries with a successful program share with the other nations that is still lagging behind. No, it's nothing to do with the information. Everything's ready. There are so many good examples. People are ready to help. It's all about political views. People are too lazy, or maybe they're unwilling to do something very easily. It's not their job to eliminate viral hepatitis. We have to knock on our head to say it is your bloody job. And again, don't blame civil society. We have worked so hard to work to around the clock to make the viral hepatitis elimination work. The only thing that really matters is how we can engage more partners to jump in this pool, to eliminate such a long-lasting horrible disease. And also the primary health care is our human rights. Don't make hepatitis treatment and testing as our benefit. It's our fundamental basic human health rights. Make sure of that, please, community friends. And I just want to thank all the speakers and audience joining the such important and the first session. It's above the time, 6 minutes. I'm so sorry, but I just don't want to end it. But just know that the WHO is just launched a new advocacy briefing on the World Health Organization Global Hepatitis Report 2026. The link and the brief will be put in the chat. And also, lastly, please complete a short survey about the webinar. Your opinions matter, and your action matters more. So without further ado, I just want to wish you a good World Hepatitis Day. Thank you all. Thank you to all the speakers.
Thank you very much.
Thank you so much.
Fantastic.
Thank you.
Excellent.
Thank you so much.
Thank you.
Very
Have a
nice
nice day,
speakers.
everyone.
Thank you,
Bye.
everybody.